Marami na naman po ang may sakit, may ubos, sipon, nilalagnat, sinisinat, panahon na naman ng trangkaso. And because health is wealth, tulungan po namin kayong pangalagaan ang inyong kalusugan. Free consultation coming up on Kababayan LA. Today is 10/11/11, 11th day of the month of October sa year 2011. A few weeks to go at Halloween na naman po. Let me invite you to go to Not Scary Farm. Check it out. I remember when I was new here in the States, yan po ang pinuntahan namin sa Halloween. Marami pong mga mazes, marami rin pong mga shows, and there are characters going around in spooky attire. Very, very interesting. It's a different kind of experience. And I'm telling you, dun sa mga nakikipag-date nako, dyan nyo po dalhin ang inyong kadate at siguradong mayayakap kayo ng kadate nyo dahil nakakatakot at nakakagulat po sa Not Scary Farm. Meanwhile, here on the show, hello and welcome to Kababayan LA. And today, gaya nga ng nasabi ko kanina, dahil marami po ang nagkakasakit at tayo pong mga Pinoy, nako, we're very notorious for not wanting to go to the hospital or not wanting to go to the doctor. We bring the doctor to you. Kasama po natin Dr. B. Hello and welcome to Kababayan LA once again.
Hello again, Janelle. Thank you for having me.
Si Dr. B po nagpa-practice sa Glendale, pero tuwing tinatawagan po namin siya, nandito siya. And this afternoon on the show, we're going to be opening our phone line so you get to ask him whatever questions you have. But first question is mine. Dr. B, flu season, winter season, marami pong mga kaakibat na mga sakit yan. What usually happens? Anong mga illnesses that we should watch out for?
Janelle, during the winter and fall seasons, it's time for the viral infections like, as you said, influenza, which is very common, and it's time for the flu shots. The other things are in children, especially in younger than 1 year old, the respiratory syncytial virus, which is a common cause for bronchitis in those ages, and also the common cold caused by 52 types of adenovirus. It's very common at this time of the year.
Okay, Doc, when you're talking about virus, does that mean na wala tayong panlaban kundi palakasin ang ating immune system? Is that caused directly by something, or talagang hindi natin alam when and where it will hit us?
Most of these viruses are very common. They are viral infections, and they cannot be treated by antibiotics. I want the audience to know that viruses cannot be treated by antibiotics. They are treated what we call symptomatic treatment, wherein if you have fever, you take antipyretics, Tylenol, and the like, a lot of fluids, bed rest, and these virus infections are really affecting the young of age, pregnant women, people with chronic illnesses, and the immunocompromised patients.
So how do you prevent yourself from getting infected? Is there a way?
Influenza, you have to have the flu shot. At this time, you should have done it already. Prevention should include careful hand washing, because viruses can live for a long time in some areas, and contact with these areas can cause you to have all these infections. But proper taking care of our health, taking the right vitamins and food and diet, plus preventive measures like the flu shot will help us prevent this from happening in our systems.
And we have our phone lines open today on the show. If you have any questions, libre po ang konsulta ngayong hapon sa Kababayan LA with Dr. B. Doctor, you said viral infection. Meron din po ako naririnig na bacterial, and I know that there are other kinds of infections. What are those?
There are 4 major types of infections, mainly bacterial, which can be treated by antibiotics. Viral, as I said, no treatment except for symptomatic treatment. The other ones are fungal, like in ringworms and athlete's foot, and also the spirochetes or Lyme disease and all these, which are common usually in the summer months.
Ayan. Marami na po ang tumatawag sa amin. If you have any questions about your health, medical conditions, and all that, we're going to be answering your questions today on the show with Dr. Banyes. First caller from Huntington Beach. We'll take the phone call when we return. Don't go away.